Tobacco smoking is something many of us encounter every single day, whether it be lighting your own cigarette or walking through a visible cloud of secondhand smoke. Despite elaborate efforts by the public health community and their success in reducing tobacco use, in 2016, 37.8 million adults in the U.S. were still current cigarette smokers. Smoking is a modifiable health behavior, yet remains the leading cause of preventable death worldwide. Smoking harms nearly every organ in the body and increases the risk of cardiovascular disease, respiratory disease, and cancers.
Young adults from ages 18 to 25 have the highest prevalence of current cigarette smoking of all age groups, at 34.2%, according to Substance Abuse and Mental Health Services Administration. The target prevalence estimate reference in Healthy People 2020 for current smoking among adolescents in grades 9 through 12 is 16%, and among adults 18 years and older is 12%. The prevalence of current cigarette smoking was higher for young adult males than for females. White youth had the highest prevalence, 39.1%, followed by Hispanic, 27.4%, and Black, 23.3% youth. Risk factors associated with this problem is that those non-college educated have a higher target by marketing and advertisements. Some are unaware of the long-term effects, and others believe smoking a little will have no effect at all to their health.
Recognizing tobacco use as a health hazard has been one of the top public health achievements. Up to this point, there have been legal and marketing tools addressing the problem with smoking. Legal policies that regulate the age of who is able to purchase tobacco, for example, has helped control who is purchasing and consuming. In terms of marketing and counter-marketing tools, there have been public service announcements, warning labels, and packaging designs that try to keep people from smoking. Public service announcements or ads such as those from Truth create impactful commercials and present the effects smoking can have on your health. Proposition 56 is another example of policies taking action towards the issue. This proposition, which was passed in 2017, implements a higher tax on all tobacco products in California and directs the revenue towards Medi-Cal. People with a history of smoking can get screened for signs of lung cancer. There are many sources of treatment that smokers who want to quit can turn to. Many of these include medication and counseling. The line 1-800-QUIT-NOW offers free over-the-phone counseling.
Taking steps towards desensitizing tobacco and smoking to the general population has helped alleviate the prevalence of public smoking and exposure to secondhand smoke to young children and young adults. Unfortunately, tobacco and nicotine use is rising in young adults, especially on campuses. The use of tobacco is increasing to the point where most students have a Juul or a Soren, and they use them publicly. The next step in the public health perspective would be to minimize the use of tobacco and nicotine throughout UCSD and throughout all other campuses, possibly by establishing new policies and rules of smoking, educating users on the addictive and unhealthy side effects, and desensitizing the quote-unquote cool look of smoking among the young adult population.
The information about damage of smoking tobacco is available to the public. The UCSD campus is tobacco-free, so no smoking is allowed due to the health risk. Even though the campus is tobacco-free, there are some places on campus that students smoke. If students do not want to smoke anymore, they can look for information online in a UCSD website that provides information about the smoking cessation. In the website, there is counseling for students who want to quit or want more information about tobacco use. If they want to seek care, the student can call the number of the UCSD Health Promotion Services and make an appointment and receive the help they can. The misconceptions about tobacco use is that it only causes lung cancer. But that's not true. The fact that tobacco use can damage nearly every organ and organ system in the human body. Health practitioners and healthcare systems can have discussions in class or go to places where the students smoke to let them know the damage tobacco does to them.